Welcome to the Art of Patient Communication. I am Dr. Kritika Mehra. This is the first time that the future of dentistry is not coming, it's actually here. We are working with artificial intelligence as we speak. And today I will be talking to Dr. Jimmi Patel to unpack this further. Hi, Jimmy.
Hi, Kritika. Yep.
Today I want to talk about the really hot topic, which is AI.
Okay.
And artificial intelligence in healthcare. And obviously it's the buzzword right now.
Yes,
So
absolutely buzzword
yeah.
everywhere.
And I think I want to unpack with you today because AI is giving us two types of emotions, right? It's some people are very curious. There's a lot of curiosity around it, like what it's going to do for all of us, not just healthcare sector, any sector.
Yeah.
And the second emotion is like the curiosity. The first part is the curiosity.
Yeah.
And the second part is the discomfort or the nervousness that, hey, it's going to replace me. The fear, right?
Yeah.
So let's just unpack how artificial intelligence or AI is going to work with us in healthcare and how it can work against us. So if we start, obviously our experience comes from running our dental practice. So a lot of what we will say today will be coming from dentistry, but I'm sure it's the same in healthcare
Any
in
other
general.
health sector. Yep.
So let's start with where it will add value, right?
Okay.
So starting from the first point of contact, which is when the patient calls us, which is the reception, the reception aspect. How do you think AI is going to make or break the deal for us, or make it? Let's talk about making it.
So certainly both emotions are very genuine in terms of the nervousness or the anxiety in terms of what's going to happen, not in our sector, but in general our lives, because every business, every sector is basically struggling to get their head around what it truly means for them in next 5, 10, 15 years of time.
Yeah.
And just the speed of it is just absolutely something that we all are struggling to keep up with.
Like it was coming, and now
and
it's
now
kind
it's
of
there.
running.
And at the same time, the way it's running, someone told me this analogy that if you compare to the cars that we are driving right now to the cars that we were driving in 1970s or 1980s, if you do the literal comparison, there is still like 30, 40, 50% of the features or what the cars look like and what they did is still the same from 70s to now or 80s to now. Versus AI, what it was doing, forget 5 years ago, what it was doing 5 months ago to what it is doing right now is significantly different and much more powerful. So if you start looking it under that lens, the future at least looks scary because we just don't know what it means for us. If we then apply it to our industry, especially dentistry or health sector in general, of course, both emotions are true. But at the same time, there are a lot of positives, at least in my opinion. Again, I'm only speaking of from my opinion, what I've seen, read, and heard. From the patient journey point of view, the very first thing comes to when patients sort of walk into the health practices or dental clinic. I suppose a lot of those things will be, reception would be in my opinion, would be the part of our sector that would be the most impacted by AI, because a lot of what they do is administrative task. They are the ones
like booking patients, listening to the complaint,
correct,
or rescheduling,
correct,
and data gathering,
all
who's canceling,
all of that. From what I'm seeing and reading, will be replaced by AI. But I still believe that it cannot replace our reception team completely, because there is still a very large portion of what they do is very one-on-one person, human-to-human interaction, care. Because care, we've said it many times in these episodes, that the care starts from the very first point of interaction to the very last point of interaction. And reception is the first and the last point of interaction in patient's journey. So that care piece cannot be replaced by AI.
Yeah, that's right. Because, as you know, like we were planning to implement, or we are planning to implement AI in our reception area. And my team was extremely concerned. They approached me and they said, look, we are really worried about us getting
and that's what we mean by that anxiety piece. Yeah.
And I think what it was, and once we had this discussion, it was we kind of stood up thinking that, what, if we don't embrace this now, we will be left behind, because if we don't shake hands with AI, you will be dinosaurs, right? We will not be able to keep up with the world, because that's where it's all heading.
I think it's the view, if you take the binary view in this conversation where I'm for it or against it, then it's definitely going to not help you or harm you in that sense. We have to, and that's what we did with our team, that, okay, don't look at it from the force that's going to destroy what you do. It's basically something that's here to stay. It's not going backwards. If anything, it's going or moving forward with or without you. And the way we need to embrace it is that, okay, let's look at the aspects of what it does that can help us and make our life easy, and then focus on what then we can do that's going to be better for the business in general,
or for the
clients
journey.
Clients' journey. And then use this software or this new technology to make patients' experience better, and then make their life easy or work life easy, so that they are not getting bogged into the tasks which are really labor intensive and repetitive. So basically they have to see it from the point of view of that it is here to help me, not replace me. And that shift in their mindset is something that the leaders will have to really do. And we are hearing this every day in business world, where big companies are rolling out these big projects where they are helping their team understand and accept the role of AI in their day-to-day life, and then really making it support them.
And I guess, like, moving on in the future, I think this will become a very vital thing in your resume or a CV, that have you worked with AI in the past? Have you collaborated with AI? Because if you do, then yes, you are relevant. But if you don't, then the relevancy drops.
One of the CEO that I was listening to on another podcast in America, they actually have put it as part of their KPI to do the performance review, that, okay, every employee should minimum spend, I think it was somewhere around 2 to 4 hours a week working with AI. And if you cannot literally prove that okay, I was working with AI 4 hours every week, then that's going to count against you. And then that goes into your performance review as a negative remark, because they have realized, because Americans, everything is happening in America at the moment. They are at the very sort of forefront of it, or front line of it. And that's where if they are doing it in their workplaces, then we have to take this thing seriously, because it's changing pretty fast.
Absolutely. So, okay, so that was the reception take, right? So now let's move into the clinical rooms.
Inside, yeah.
Now again, because we both work as a dentist, we will talk about dentistry. So starting from the first stage, when the patient sits in the chair, and they are telling you their chief complaint, their concerns, and you need to gather the data for diagnosis and treatment planning. So again, breaking it down. So let's see how AI is going to help us in diagnosing and data gathering.
I think that's the part that I think is changing from the health sector's point of view. It's changing significantly and quite at a big pace or high pace, because what's happening in health sector is, and this is where AI is adding real value, because it's really streamlining the process of, data gathering for patient, sort of unpacking the information provided by the patient.
And because it's listening live to the patient.
Yes, there are a lot of sort of, AI note-taking sort of softwares already available. So it's compiling all the information from the investigations and the data gathering process.
Yeah.
And it's throwing out this initial diagnosis piece for the health practitioners. And then that's being really sort of, it's happening very fast now, where the clinicians can get that early diagnosis with the differential diagnosis very quickly.
What about, so for example, there's an X-ray, because I've heard that there are some dental AI tools that can break down
the radiographic images. Yes. So it's looking at all the investigation pieces, and then it's coming up with the diagnosis and the radiographic changes and everything. So yes, that's definitely happening. But in my view, and this is where what we've said, which is it adds value, but you cannot, at least it's not there just yet. It may get there in future, but I think AI is not there where it can throw out a diagnosis and then you just take it on its face value and you run with it. So yes, it's good at giving you that early diagnosis, especially if you are a young clinician or early in your career. But at the same time, you have to then apply your expertise, knowledge, understanding and judgment and look at it from that point of view, and then make a decision that is still human driven. And again, I'm talking, that's where we are right now, I believe. In future, it might change, and I believe it will change. But with the diagnosis piece, I think the final say still must be done by the human. That's where we are at.
If you look at that part, so, I'll just go back a little bit. Like if you look at reception part, yes, AI is going to help you, but you still need that human component to check in with your patient, make that eye contact, say hello to them, say goodbye to them, or say how did you go to them at the end to complete the picture. In the diagnosis, same thing. AI can roll out all this information, but the clinician's input, that piece of the puzzle needs to be there to confirm that, to say, yep, that's right, we're on the right track, and this is what we are doing. So again, still the fear is nicely compensated by a need. So it's not one-sided. It's not.
So and again, this is where I took a long time to accept it, but I think I have accepted it now from everything that I have understood about AI, is that it's not there yet, but it probably will get there, where it's listening to everything. It's looking it's looking at everything. It's listening to patients' comments. It's listening to clinicians' comment. It's looking at all the investigatory sort of tools. It's looking at all the symptoms. And then compiling everything together. And then it can actually throw out the diagnosis. It can punch out the diagnosis that is super accurate. And then you can just literally run with it. So I believe it will get there. And then there will also be the piece where these AI tools will be trained by the clinicians themselves, because then it also is taking into account the clinician's aspect of the practice and the experience.
Because I was going to say, like, would you say that? So you know how we talk about that as a clinician, you can, when you are proposing a treatment plan to the patient after knowing the diagnosis, you can have your biases in there. Like, hang on a minute, this is my daily target or this is my monthly target, and I'm going to propose X, Y, and Z patient to the treatment to the patient, so I can make that target. Or any biases, like, or I don't know,
or I don't feel comfortable with
doing
the procedure,
this procedure, so I'm going to recommend option B. So AI, even though it can be unbiased, like on its own,
it can be trained
but
to
it
be
can
biased.
be trained to be biased. So if it was my, because we have noticed that how it's a pleaser constantly. It never disappoints you.
No,
it's always
never
talking
does.
you.
That's
so
right.
I think from that aspect, it's only going to give my patient the options that it thinks I'm going to please my boss with that, so I'll just do that.
Funny you said that. And the other day we were having conversation and the way I see AI is a team of minions. Okay. So as you see minions, they are helpers. They love to help you. They will do everything that you say. But at the same time, if you do not control them, and if you don't give them a clear direction, they can create a lot of chaos. So that's where my opinion sits at the moment, where yes, they are there to please you and help you and do everything that you want it to do. But at the same time, you really have to give them direction. Otherwise, it's only going to increase your headache later on.
Yeah, that's right.
Yeah.
So I think, so then we come to the treatment planning. So we've already discussed that we need the human input, right? The
Correct.
clinician input.
At the moment, yes.
Yeah, and we also need to plug in. I know AI has already heard the patient expectations, patient anxiety, patient's chief complaint. It already knows that, but we still need to factor in what else we know about the patient that the patient hasn't said, because we can see the body language.
Yes,
AI can't.
That's correct.
So we need to plug all that information in to get the right treatment planning.
Correct.
So, and then obviously the execution piece is in clinician's hand, right? We have to have the skill to execute what we have promised to the patient.
Correct.
So let's look at it from a patient journey. So for example, I believe that AI is an excellent communication tool. So for example, sometimes when I am talking to my patient and I reflect that, oh, that conversation could have gone a lot better if I said this, or if I gave them an X analogy or a metaphor or something like that.
Correct.
And at times I run out of analogy. So sometimes I go back into my chatbot and say, you know what, like I wanted to explain this. How could I have explained that better?
Yes.
And then it spits out this analogy, and then you're like, like I could have just said that, which is what I feel. I feel like the AI can really dumb it down for you, some of the emotions and what you're trying to say. It reads in between lines and it really understands what you are saying.
Yeah. So I think the different level of communication is something that is very powerful with AI, and it can really compile this very complex data and put together a very concise version of what needs to be said and done. And especially from the communication point of view, it can really give you that one piece or one page document that sort of sums up everything really well. So from that point of view, I think that's where I get excited about AI, that, okay, it can really help us as clinicians to really communicate and bring the patients to the same level of understanding at where we are at.
So you empower them a lot better.
Yes, you empower them a lot in the decision-making process. So that's definitely the benefit of AI at the moment.
And I think even like, just the, like, for example, like, a scenario A, when a patient comes to you and you explain them everything, you bombard them with all this information, you send them home with a piece of paper. On the contrary, scenario B, when they are in the chair, you explain them the whole treatment plan, you give them a summary, you email them a summary, right? And then the following day, the AI reception, calls the patient up and say, hey, do you have any question? You had consultation with Dr. Jimmy. How did you go? Do you have any questions? Can I help you? And then day 3, can I book your appointments? And A, B, C, D, all the appointments are done. So all that work is so much streamlined, where it can really add a lot of value and leave us clinicians with time to connect with our patient.
Correct.
Right? And develop that trust and rapport with them, where you can add value in patient's life.
We all know that we believe that we are good at multitasking, but we truly aren't.
Yeah.
So from that point of view, right now in clinical scenarios, most of the time we are multitasking. You are talking to the patient, you're asking them question, and as they say things, you are collecting everything on a piece of paper or on a computer screen. So AI can really do all these supportive tasks for you, and then leave you with what you need to do and focus, which is what we're good at, which is connecting with the people, listening to them, asking more personal questions, really lean into the conversation where patients feel like they're dealing with humans who genuinely care and human who is not distracted in protocols of writing notes and capturing everything and trying to do this multitasking. Because from the patient's point of view, yes, at the moment, the current system is where patients are almost used to this, but there can be a better world out there in future where patients feel really connected with the clinicians, because clinician is only having that very personal one-on-one conversation. And once everything is said and accepted and agreed on, patients or clinicians can then move on to the phase where they are just focusing on delivery of the care and not worried about this administrative sort of burden that they still have to do in a current scenario.
That's actually
so
very
it will
true.
It will really improve that patient clinician relationship And that simply means that patient journey gets better. It's good for the industry overall from what I see.
Yeah.
Yeah.
Let's talk about, Jimmy, the negatives of it. Like how can it really how can it impact the industry negatively, or a clinician negatively?
Similar to the minion analogy, which is, if you are not checking and controlling what it's saying, then, so simple example is overdiagnosis, right? So many times we look at the radiographic image or look at the symptoms in general, and then we believe that, this patient needs A, B, C, and D treatment, right?
Yeah.
But at the same time, at the clinician level, because we have understood the patient or the human behind the concerns, we know that, okay, yes, these are the treatment possibilities, but at the same time, you prioritize them, which probably AI can do that. But still, even then, what's that line where you act versus where you wait and watch?
Yeah, that's right. I think the nuance is missing.
Nuance is missing.
Yeah.
Health sector is not a black and white mathematical sort of equation or very sort of 1 + 1 = 2 every single day type scenario. It's health sector is very subjective. Health sector, no two scenarios are the same. Every scenario is different. Every human is different. So doesn't matter how smart these models will get. They will never be able to capture every possible scenarios, because again, you are dealing with human beings or living things. And also, we are very unique because we have brain, the most developed species on the planet. And that brain is always going to come up with something very unique, which as clinicians, we have to read, listen to, and take into account when we are proposing the treatment, making the decision, doing the treatment delivery. So AI can never replace that. So the real risk from our point of view is, if you become too dependent on it and thinking that that's going to make all the decisions for you, then you are not going to do justice or do well for your clients.
That's right. And I think, how I said to you that how I started to think, I know that it's a pleaser, because it only happened like when I used to just have a, early days when you kind of communicate with it, you talk with it, and you think, how come in every scenario I am right?
Correct.
Every scenario I sound very good. It makes it sound so good, so positive. Yes. And I think that's where the reflection kicks in, that you have to punch the data in, but what it gives back to you, you need to reflect on it. And then you think, right, will this fit in the world or not, or with my patient?
Without saying real names, I looked at one of the radiograph analytical sort of software, AI software, where you put the radiographs in and it tells you what's wrong with the teeth and the bone and everything. Yes, it was pointing out a lot of things, and it is good to say that. But at the same time, if I show that graphical sort of image to my patient, it can almost come across as scary, because then it's pointing out every little change, whether it is 5%, 10%, and then it can make the conversation very complicated if the patient is already nervous and anxious about it.
That's right.
So in those scenarios, we sometimes withhold some of those information, because we know that we want to drip feed the patient about, okay, I can see 5 things that I can talk about, but looking at patients' anxiety levels, right now, I only want to talk about the first 2, right? And I'm just going to completely park the other 3 aside, because it's just not going to work. Now, this is where you can get bogged into the protocol of thinking that, okay, what if I don't say it all, and then it's going to come to bite me later on in future? But I still believe
that's the balancing act.
That's the balancing act. And this
doing.
Is what we are talking about. It's not a mathematical equation. So you have to make those human judgment that, yes, I can see these 10 things, and out of those 10 things, yes, I didn't see those 3, and I only saw the first or identified the 7 things. But then, do I really want to talk about all of them? Because that's where you may lose the human touch, and then you can come across very
robotic.
At the end of the day, the word says artificial intelligence.
It's not the real intelligence.
It's not the real intelligence, and not everything that we do is well received if it is artificial. We are in human care industry, and it cannot be 100% artificial. It just doesn't work. If someone tells me that everything that's happening in my body in terms of the treatment, I'm the patient, and what's happening with me and my health is 100% artificially driven, I'm going to be nervous. I don't care how smart the software is, but at the end of the day, I'm human, and I want another human to understand where I am and what I need, and then I want that factored in.
That's right.
Okay, so without that, I'm not going to feel comfortable, and I see the same for my patients. So that's where the risk is. So as a clinician, we have to have the last say of, okay, I get it, but this is what I think.
Thank you, Jimmy, for joining.
Thank you for having me, Kritika, again. Thank you.
And I think from today's conversation, we can easily understand that AI is not here to replace clinicians. It is here to reduce the friction, to improve consistency, because our patients still need human touch for perspective, trust, and clarity. And only humans can provide that. Thank you for listening. I hope you got something out of it. Like, follow, and subscribe. All the links are in the show notes. See you next time. Bye.